All right. Thank you everyone for joining us today for the Pediatric Reunification module series. This is module 5, Demobilization After Action Reports and Recovery Phase, presented by Dr. Neeta Gupta. So Dr. Gupta, if you'd like to take it away.
Thanks, Holly. Hi, everyone. My name is Neeta Gupta, and I'm a pediatric emergency medicine physician at Children's Minnesota. Today, I'll be presenting about the Pediatric Reunification Module 5, which is Demobilization, After Action Reports, and Recovery Phase. Feel free to stop me at any time if you have any questions. So the objectives for today is to understand when demobilization should occur, who should be part of the after action reports, what education should occur during the recovery phase, and have a key focus on behavioral health after a disaster. So thus far, you should have learned about patient tracking and registration, opening a family reunification center, family reunification site, and a pediatric safe area, activating and exercising a reunification plan, and taking into account legal considerations. It's time to deactivate the reunification center. So how do you know when it's time to deactivate your plan? Well, when we go back to our incident command structure, you'll see the family reunification branch falls under the operations section. Within the family reunification branch are the 4 key elements that have been previously discussed. When it comes time to deactivation, the family reunification branch director, in conjunction with the incident commander, should be the one to make the ultimate decision to demobilize the FRC. Demobilization should occur after a list of triggers that are predetermined in the reunification plan. Examples of triggers are fewer than 3 families in the reunification center, no unaccompanied minors remaining, rescue operations have ended, or a community family assistance center has opened. If a community center has been established, families should be directed to that location as the hospital reunification center is slowly scaled down to closing. Many times you will notice both a family reunification center and a family assistance center are open at the same time. This is important for transition from a hospital-based operation to a community-based operation. Make sure there's close communication with the families and the Family Reunification Center, local agencies, and law enforcement prior to closure, so there's no confusion. There should be a clear and relevant message that is pre-planned that will be released by the public information officer on all public and social media platforms. Ensure messaging can be accessible for those with functional needs, such as hearing or speech impaired, as well as available in multiple different languages. Any questions about demobilization for your reunification plan?
Feel free to unmute yourselves, submit it to the chat. We'll give it about a minute to have people gather their thoughts, and then we'll move on.
Nita, this is Deanna. I had a quick question, and I'm sorry if I may have missed it on the previous one. But when we talk about the Family Assistance Center within the community, did we talk about how that transition from the hospital to the community kind of gets set up? And I apologize for bringing that back up if it was already covered in a previous session.
I believe it's not actually discussed in detail in any of the previous modules. The only thing I think I might be the first one to bring it up actually, and I think the biggest thing is making sure that there's close connection with the law enforcement and the public information officer to make sure that we have some sort of community organization that is actually doing that. So usually the assistance center won't open up until a community-based organization is actually ready to go, like the Red Cross and things like that. So
yeah, that's what I assumed too. I'm just was asking for the benefit of because I think it's a really good idea to think about having that as part of your plan, especially if there would be a prolonged
Need.
event
Yeah.
and need to make sure to kind of offload, what that would look like. So I actually think that's a really good point about talking about that. So I appreciate you bringing that up.
Good. I'm glad you brought that up. Yeah. So examples of that would be some local churches will do it, but also each community with their local healthcare coalition and their Department of Health might have some connections with American Red Cross and other community-based organizations that would help open that assistance program center up, especially if it's going on, like Deanna mentioned, for more than, a few days. Any other questions? That was good.
Okay.
Perfect. Okay, so or is there any other questions? Any thoughts about communities with multiple hospitals in the area? Oh, good question, Megan. So when there's multiple hospitals, I think it's still the same community based organizations that help out. At least that's how it is locally for our healthcare coalition, that have like a unified assistance center that is going to be open that multiple hospitals could have access to. Of course, the transition from the original hospital to that assistance center would be by the hospital personnel from each site in their localized plan.
Thanks. It just actually dawned on me when Deanna asked the question.
Yeah.
For example, in Grand Rapids, and I can only speak to what I know, right? So in Grand Rapids, we have multiple large hospital systems within a 30-mile, radius. So I just thinking that through, who's going to take control, and even with the transition after the event, if you have multiple hands in the cookie jar, you know what I'm saying? So like, mm-hmm. I guess it just is not necessarily a question, but more of a interesting thought of how to work out those details ahead of time with your community.
Absolutely. Then usually there is someone with the local healthcare coalition or the Department of Health that will be helping set up the assistance center. So I feel like each hospital personnel and incident command center and the branch director could reach out to that individual to make sure that they have the proper transitioning happening. Great points. Okay.
Any other questions? Okay.
So we'll talk a little bit about after action reports. So all Family Reunification Center documentation should be secured and given to the operation chief after the Reunification Center has closed down. After action reports should include your date, incident information, and a brief description. The report should list strengths of the operation and also areas that need improvement. Within all of these areas of improvement that you identify, specific ideas for the future should be listed so that you can then address them in the future, specifically in your simulations or in your reunification plans that you update. One very specific consideration for pediatric reunification is actually consider including the families and caregivers and even the children themselves in your after action reports and debrief sessions to understand their perspective of what happened. After action reports should be kept with the Emergency Management Committee for maintenance and review annually. The plan should be evaluated and maintained by the Hospital Emergency Management Committee annually to ensure up-to-date information and incorporating any lessons learned from exercises or real-life incidents. There also should be considerations for at least one annual large-scale exercise, including a pediatric reunification simulation during this exercise. Questions about after-action reports and maintenance?
Give it a few seconds just for people to gather their thoughts. Okay.
It's a very important topic post-disaster and recovery is behavioral health. As we all know, children are especially vulnerable during a disaster, which makes them expectantly vulnerable post-disaster. Many children actually have special needs or disabilities that require equipment that may be limited due to the type of disaster you're encountering. In addition, children may react differently than adults post-disaster. This depends on their previous experiences with trauma, coping mechanisms, and even their developmental age. So post-disaster, it may be harder on children as they have less situational awareness, leading to feelings of loss of control. Children learn from their surroundings. So if parents or caregivers have a calm and supportive environment, the child will also respond similarly. There are certain considerations that are important for pediatric mental health post-disaster. Limit the access to repeated images about the disaster immediately after the event from public and social media, as this can actually trigger emotions and increase their stress. Discuss regarding the event should take place, okay? However, the child should lead the conversation and encourage them to ask questions. And you as a provider or caregiver, follow their command and then let them lead for your conversation. Children work through these difficult feelings through play and art, so offer those mediums for communication. And when providing your explanations to them about the disaster, keep them short, simple, and direct. Make sure you're monitoring their emotional health very closely in all settings, and that includes home and school. It's important to return to normal activities as soon as possible so that you can establish that routine that they're used to. Children often feel a loss of control right after a disaster, so consider involving them in community activities that involve victims of the disaster so that they can establish a sense of control. Identify family and community strengths that they can use that can foster resilience. If there is ongoing stress that is still limiting the child from returning to their normal activities, despite using all of these tricks, then you should consider going to your general pediatrician and getting a behavioral specialist referral for further evaluation. The National Child Traumatic Stress Network actually offers a pediatric medical traumatic stress toolkit for healthcare providers on ways to help pediatric patients post-traumatic events. There's a section within this toolkit that's entitled Making a Plan, Dealing with Things That Remind You of What Happened. And that gives a creative way for children to express their feelings, which is fantastic, and you should take a look at it. Additionally, creative way for children. Additionally, another source is aftertheinjury.org, and they provide many useful resources to help with pediatric patients deal with stress from a trauma or disaster. There's quite an inventory online for post-disaster education and training for future disasters. The Psychological First Aid Online is a 5-hour interactive free course that provides tips on how to treat patients after disaster for healthcare providers. The National Center for Disaster Medicine and Public Health have free online educational courses that provide core competencies in disaster medicine for healthcare providers as well. And then the CDC and the AAP also have additional resources for providers to help children cope after disaster, including a family readiness kit for families to feel prepared for the future. These are my funding resources. They're MOC Part 4 credits.
All right. Thank you so much, Dr. Gupta.